Good morning, and thank you for coming to the fourth conference of the Tel Aviv University Center for Combating Pandemics. Before we begin, a few housekeeping rules. If you have not done so already, please mute your cellular phones. Speakers who have not uploaded or sent their presentations, please do so before your session begins. And there is a strong light here, so if there is a presentation that needs to be dimmed to see some blur images, it cannot be done. We are under strict rules from the people who are handling the filming of the occasion, so you need to sharpen your sight to handle with such images. I'm happy to invite our Vice President for Research and Development, Professor Dan Pe'er, to open the event.
Okay, thank you, Itai. So dear friends, colleagues, and guests, it's a real pleasure to welcome you to the fourth annual conference of the Tel Aviv University Center for Combating Pandemics. This conference brings together an impressive group of researchers, healthcare professionals, policymakers, and innovators, all united by a shared mission to better understand, prepare for, and respond to pandemics and global health crises. Looking at the program, I'm excited by the range of topics being addressed, from early detection and data modeling to ethical challenges and global cooperation. The diversity of perspectives and expertise here today reflects the strength of the center and the importance of working across disciplines to tackle complex problems. Over the past few years, we've all learned just how critical and crucial collaboration in time of crisis. I'm proud that Tel Aviv University continued to be a place where ideas become actions, where science meets society. I encourage you to take full advantage of the day, engage in open discussions, explore new partnerships, and challenge assumptions. That's how real progress happens. Before we begin, I would like to extend my heartfelt thanks to Professor Itai Benhar, head of the center from its inception, for his leadership and vision. And of course to Yael, the center dedicated coordinator, for her outstanding work in organizing this conference, the grants, and many other events. I'd like to wish you a productive, engaging, and inspiring conference. Thank you.
Thank you, Professor Pe'er, for these kind words. I'll say a few words, not many. So while Professor Pe'er was optimistic, I'm kind of sad to announce that this is probably the last conference of the center in its current structure. When we opened the center 5 years ago, we had a vision to have a center that will coordinate activities all over campus, and indeed this was the case in the first years. However, about 2 years ago, when COVID was officially declared as non-existing, as a pandemic, the interest in Tel Aviv University and globally in combating pandemics declined, which is understandable. Therefore, the leadership of the university, with my agreement, decided that the level of interest in the activities of the center no longer justifies its existence in its current structure. As an example for that, we can see that in previous conferences we had another session going on in parallel to the sessions down here upstairs. This is not the case this year. Indeed, the interest is dwindling, and now this is understandable. So having said these encouraging words, I still thank you for coming, for attending, for contributing, and I'm privileged and honored to invite our plenary speaker, Professor Dorit Nitzan from Ben-Gurion University. I guess, again, I'm a bit cynical today, but please approach. Unlike Tel Aviv University, Ben-Gurion University perhaps is more visionary in keeping the interest in pandemics alive. So Dorit is the head of the School of Public Health at Ben-Gurion University and the director of the master's program in emergency medicine and chair of the food systems, One Health and Resilience. She had a very impressive international career in handling health crises at the WHO and other organizations, but now she is contributing to Ben-Gurion University. Perhaps we can learn a thing or two how to make things maybe more focused or more appropriate for current times. So, Dorit, thank you for coming. This is the pointer. Use it wisely.
Okay, thank you, Professor Benhar, Professor Pe'er, Professor Adini, all my friends here. Just to make clear, the School of Public Health, not the school, the emergency program in Ben-Gurion University is actually created by Bruria. So, I mean, we are just following her footsteps, and the Ben-Gurion took it very seriously, and we continue. So, but we have such a great relationship. We learn a lot from the program here, and you'll see that also historically, Bruria headed the program, so it's not surprising that we are doing many things together. I just want also another small remark in regards to what you just said, Professor Benhar. This is very sad. I'm asked to present in the infectious disease conference that will be in June in Kfar Giladi. It's for the infectious disease doctors in Israel. And my lecture would be on how we destroy good things after pandemics. And I'll share with you the presentation after I'll make it, because you'll see that we're not unique. It happened in the past. Humans act very violently also against viruses. They don't believe each other and they destroy what they have. But then comes another generation and starts again and build back better maybe. So let's hope that it will work. But it's sad, it's really, really sad times. Okay, I have to use it wisely, but it didn't work. Okay, all right. So I want to just highlight, first of all, to convince you all that our programs here in Tel Aviv and in Ben-Gurion needs to be strengthened, need to be stronger, and need to be agile and adaptable to the current circumstances. The more the world is under emergency circumstances, specifically here, we need it more. The fact that we want to destroy many things doesn't work, because we can see that emergencies take a toll and profound effect and impact on health, but not only health. The other point is that every emergency, everyone has to do with health. Give me one emergency that doesn't impact health, and you'll get an award. There is none. So all of us have to be thinking really well how to deal with it. We think of Gaza, we think of our situation here, but we must understand that there are hundreds of contested and disputed areas around the world. All those black holes where the sovereign that is regarded as the authority by the United Nations does not rule really effectively or not at all. Those areas are black spots where conflicts outbreaks, and any disaster can happen. And that's also important to mention that emergencies are divided into groups, but a crisis becomes a disaster when the routine systems do not function, at one thing, and also it's not enough. We must have those functions in routine times, but also preparedness. If they are not well prepared, every emergency will become a disaster. And that's our goal. Our goal is not every time we can prevent things, but when they happen, we want to be able to resist and to reduce the impacts. As I said, the disputed areas. A thing that we must remember, because those territorial disputes, I listed only few of those 150s, but in each of them, there is a really boiling crisis. Sometimes it's overt, and sometimes it's just ready to come. I've been I mentioned here because in those I took part in some humanitarian actions or activities, but some of them we really, really forget and we don't pay attention. We have to understand that international conflict leads politicians to one direction, and with that starts the whole domino effect. The number of armed conflicts since the end of civil war is increasing now. There was kind of good time, and then humans tend to forget, just like we forget about polio and others. We forget because we are not there. We don't learn from other stories. Another issue is displacement. Displaced populations, refugee and internally displaced people that are forcibly displaced, increasing as well. The numbers are increasing, and this is just at the end of 2023. We are waiting for the new data that is arriving, and the numbers are going to be much higher. The climate-related impact and the hazards that are coming with climate change, we can see the impact, and that also impacts the displacement, the wars, and of course outbreaks and other bad things that can happen to us. Those displaced populations that are forcibly displaced, I'm not talking here about migrant workers that leave their homes for work. We're talking here about forced displacement. The global risk landscape that is done by the World Economic Forum, this is a questionnaire that is sent annually, and they look at this, and you can see the changes over time. The state-based armed conflicts are becoming the most important one globally. Extreme weather conditions after that, and geo-economic confrontation. What I wanted to emphasize is the misinformation and disinformation. 7%, this was not seen before COVID. These 7% are dangerous because they are leading many things and pushing and pulling the academia out of everything. So if you look at all those, you can see that, of course, many of the issues are not natural. They can be prevented. They should be prevented, and we should all at least be prepared for. The global risk landscape is interconnection, because as I said, health is always an issue in everything, because you can see here, can you see my, yeah. So you can see the decline in health and well-being. Whatever you start, it hits. Emergencies and determinants are bunched together. They come in groups, they are kvutzot, they come together, and they don't live together. Some of them live later on. It takes a long time for them. The other aspects. Now I zoom in, and just to show you how state-based armed conflict is harming the health. You can see the whole chain here, how it is at the end harming our health. Censorship and surveillance, one thing that we never thought about before. Censorship and surveillance are making misinformation and disinformation to taking over, and that actually harms our health. Pollution, of course, with infectious diseases and decline in health and well-being, and adverse outcomes of frontier technologies. All those technologies that we love today, that we are getting excited, have side effects. Some of them will create emergencies, new type of emergencies, and they are connected as well with decline in health and well-being. One of the issues that I heard from my colleague from WHO is last week, it hasn't been published yet, is that in one of the hospitals they had a cyber attack, and every child that had a blood test that day was diagnosed with leukemia. So you can just imagine what it created. So things can go wrong because someone with the AI made a mistake. It's a man-based. It was not a cyber attack. It was someone in the hospital was doing some data, something in the AI, and mistake. Here it came, and then there was a mess. And I don't know if it will be published, but they were so upset. Insufficient public infrastructure and social protections are also issues that create emergencies and decline in health and well-being. So all these determinants, we usually don't think of them as determinants of emergencies. And that brings us to the lack of preparedness. Our world is really not ready at all. We have expertise gap. Many people think that they know, they read something, they say it. We don't have the right training and the right scope of training. Things are demolished, as we heard before. Monitoring and accountability is something that many mechanisms do not take and do not monitor, evaluate, and are accountable for what they are doing. Lots of financial gaps, and also the R&D and supply chains are usually forgotten, and they come into the frame when the emergency erupts. And then agreements are done quickly, things are done abruptly, and the systems are not really agile. Yes, they act quickly. They acted quickly, but they were not prepared. They were not agile. They didn't have it in advance. You have to start flying all over to go shopping, which is fine if you like to go shopping. Humanitarian funding has decreased as well. And that's we see lately with the current administration in the US, that many have lost their job, funds are gone, but more than the funds, those humanitarian fundings mean that we lost expertise of people that know how to do it in the field. We lost the ability to do it rightly, and the funds that are being poured in some hotspots are not used wisely, mostly. We know today that universal health coverage, meaning that all people have access to good quality, continuous, and seamless health services, is a key and it comes side by side with emergency preparedness. So access to essential life-saving health services and public health interventions are the two sides of the same coin. We see that countries that do not have universal health coverage cannot be well prepared, like the United States. Countries that do have universal health coverage are not well prepared if they didn't go through the other side of the coin and making sure that they have the system there, like something that we are so proud, and we have Dr. Yoffe here, and this is Magen David Adom. If you don't have those systems integrated into our daily life, it doesn't work in emergencies. And we see it in many countries. So there are good points in some countries in the world. Another point that we tend to forget with the COVID, the deniers are coming in a bunch with the anti-vaxxers, and they come in a bunch with those that want the state to go away and money to control the world. What we see today is what people refuse to believe. The averted death due to the vaccinations, the COVID-19 vaccinations, are immense. We have lots of data now. There is no doubt. The evidence is there. Those that do not know it do not want to know it. The thing is that preparedness is actually key for everything, but it comes hand in hand with prevention and with readiness, response, and recovery. All of this machine, in many emergencies, we act together. We prevent while we respond. We prepare while we respond. And this is because preparedness was not put at the center already in the beginning. We are dealing with lots of risks. The world is a world of risks, and there are different ways to look at it. Some people divide actions according to either its preparedness, response, and recovery, and we can analyze it mathematically. We have different approaches, like the approach of the WHO. It's the 5C, and 5C's approach, we added a few more. It means that our students, where they study here or in Ben-Gurion, they all learn about command, control, coordination, communication system, collaborative surveillance, community and health workforce, safe and scalable care and dual approach, health core and access to countermeasures, as well as the collaterals, what happens with the misinformation, disinformation, logistics, and other things that are so impacted by each of the capacities that each of our experts need to know well. We want our experts, those that graduate from our schools, from our programs, to have toolboxes, very concrete toolboxes. I put here a list of just a few, but our students, and I'm talking generally, also our students, right? They are all coming out with this experts toolbox, and it's very important for us. Many universities around the world practice that. In fact, we have leading universities that are already dealing with emergency or disaster management or emergency medicine, depending on the title and what they provide. But they are very interesting, good universities. I put Tel Aviv first, and second Ben-Gurion, and third Haifa, which is actually not in the School of Public Health. It's under the Geography and Environmental Studies. And then other, for examples that we are in touch with, we are working together, and our students are in touch with students there. Here are more in the USA, and you can see where they belong to. Many are in the schools of public health, but not all, because some of the aspects that they emphasize differ from what we do. So in Ben-Gurion, what do we have there? So in the beginning, the emergency medicine department in Ben-Gurion University for the paramedic education was established in 1997, and the second degree was initiated in 2009 to address the need of the academic advancement in this field. Later on, it was moved from one school, the School of the Health Professionals in the university, into the public health. Professor Limor Aronson was the founding director, and she was followed, as I mentioned before, by Professor Bruria Adini, who later moved and joined Tel Aviv University. Our curriculum and everything we do is actually in collaboration with the school here, and we are really feeling like sisters, right, all through the way. Our program mission is to train, first of all, leaders. So we have leaders that are already in positions that want to advance their knowledge, but also to develop leaders, to advance research, and to have global impact. So in Ben-Gurion, we are putting an emphasis on the global impact, on humanitarian aid and support that we do there. We have theoretical models and technological integration, teaching different aspects, as well as historical analysis. Our students are learning about the history of emergency events and try to learn in the wisdom of hindsight how to deal with it. Also, custom solutions that they developed. We have 3 centers under our program. One is the Prepared Center, the Environmental Health Center that was just opened, NERI, and the BGU 4 Center that it's Food Systems, One Health and Resilience. Each of these centers has their own activity, own fund, and supports researchers and students in the program. Our scope of studies is now being a bit modified. Until now, we have 2 academic years with 4 semesters without summer semester, but we are starting 3 semesters tailored to emergency medicine and national security. That stream will be very specific and will enhance national security. Our curriculum will be tailored accordingly. We have the research track and the regular track, and the students decide where they want to go. The preparedness and readiness, and then we have different topics. I tried to list them so that you can see what we teach. But the teaching methodology is different, and we are trying to diversify it through the years. We have interactive learning, experts that are coming to share with us their expertise and knowledge, scenario-driven events, communities, lifeline events, and global perspectives where our students already are going now to the WHO and get some internship within the organization. In our program, everyone can apply, anyone from any background, as long as they have the right grades, because we want diversity. We even have a photographer, actually 2 photographers from Bezalel that now joined WHO as emergency photographers and media experts. So it's very good for us to have people. We have teachers, we have journalists, and it's good to have all of them together. Of course, veterinarian and all the medical fields. The master's has real world application where we bring stories, and we have a specialized track that is offered to our students. We are going through different building blocks and trying to play games with that. We are moving the program and shifting it year to year, trying to become more relevant. It's really not easy because we have here what you can see here, what the ASFER, the European Society, School of Public Health Association, recommended. So we took some of them and trying to move, it's still moving around, as you can see. This is our puzzle. This is the current program. Those with check are the obligatory courses. They must be taken. The others are selections. We don't offer those selections every semester. We diversify it so that in the 2-year period, everyone will have a chance to select one of those. And we are now in the national, in the stream, the new stream, where we will do 3 semesters with emergency and national security. We will have more clinical aspects added to it so that all the health workforce can really train themselves to do the emergency side in their institutions and in the field. We also pay huge emphasis on health systems. So even those who come from other fields have to learn about the health systems. They learn what a country needs as a baseline before they move forward, so that they will understand the different parts of the system and know what needs to be repaired. The emergency management cycle, you can see that we are using all the topics when we teach about that. We have very concrete curricula that goes well with the UN organization and the UN universities, so that our students will be able to go abroad and work there. As well as ethics in emergencies, we go through different parts. The international health regulations are very important in our core curriculum, and we are always discussing what and how to implement it in peaceful and in emergency times. The IHR, if you don't know, these are a set of international rules that even Israelis took part of it, that oblige us to report and respond and prepare to emergencies. Our teams, those who want to be humanitarians, focus on humanitarian aid in the field. They learn the sphere standard, they know it by heart. The sphere standards are the standards that tell us, dictate us what are the minimum standards in the field. How many calories, how many grams of protein, what medications, what to do with mental health. They really have, it's a book that they must learn deeply and know it. And now when we all discuss about humanitarian aid in Gaza, they have concrete work to prepare and advise the country, but no one is listening to them yet. We have addressing vulnerabilities is another area where we have Stav, our Dr. Stav Shapira, that is running that part, the vulnerabilities and resilience. Lots of attention on some vulnerabilities like deafness and blindness, and also problems in motion, movement, etc. So we have people that are working. We are also, we work with Adi Negev, if you know Adi Negev, in the south, the center that was built by Doron Almog, in the Negev, near Ofakim. Adi Negev is part of our school, and we are doing some work with them and research with them. Health diplomacy became a big issue for us, and this year the previous Minister of Health, Advocate Nitzan Horowitz, is running this course with me, and it's really exciting to see how things look from the bench as opposed to the real world. We pay lots of attention on who is WHO, how to work with WHO, the WHO Health Emergency Program. We speak about applying, how to go through the selections so that people will be able to understand how to do it. And as I mentioned, the national security dimensions are already in our program, but are going to be enhanced in the future. We work with communities in the north and the south, and we are trying to build resilience of communities. We have a project, we call it Kalab, Karov Labayit, close to home, and it also stands for Kehila Leman Briut, Kalab. And here we go from bottom up. Our students are escorting communities and help them develop their skills. Our partners are the defense forces, governmental authorities, Magen David, and the local authorities. We work closely with the primary healthcare and the civil society organizations in those places, because after 7th October, we understood that everything has to be in-house, ready to roll out. Lots of attention we put on early warning systems in different technology, but not only technologies, safe havens, where you move and how you move people, how you medevac them from one part of the world to another part, and to do participatory planning, since we want that our people, our graduate, will be able to go work in OCHA, the organization that oversees the coordination of emergencies. We have research methodologies that we use and we have to improve it. This is an area that we are not strong. We have to improve the research methodologies because we are doing mixed methods, but we want to have more laboratory and real field research that would help us to do it. Technological innovation, the students have to develop a tool, and we have some that already did some things it's theoretical, but we proposed it to the Ben-Gurion University IT technology development group to see if it works. We emphasize the One Health approach. The One Health approach is the approach that links the human health with animal, plants, and environmental health. And we try to bring also multi-sectorial and cross-sectorial experts into the classes. Food security is another big issue. We have now nutritionists that graduated from the program, and they are working in the field, and they come and help the team to learn it. So what we want to say, to find out, we haven't done it well yet, is to define our program impact metrics, to see what impact did we make. We want to see the new and on-the-job development for the people. We know theoretically that some people got jobs in different places, but it's not collected in the right way. We want to ensure that we have close international partnership, and we are following your school here, your Bruria's initiative with the collaborating center of the WHO, and we are receiving a collaborating center for some issues with the European region, probably in the next month. We want to see also how many of our graduates go on field deployments and what percentage or how they do in scientific excellence. These were issues that we discussed among us. We are also looking at other issues to try to see how to measure our impact. Because if we will measure well, maybe we will survive. Maybe not, I don't know. But anyhow, I want to thank you for this opportunity. And as everyone else, we beg to let our people go. Thank you.
Thank you so much. Questions for Dorit? Well, yeah.
There is an initiative in the Knesset to resign from WHO.
Yes.
What do you think about it? What
What do I do?
Well,
We are following Trump's example.
Yes.
How can we?
Thank you. Very good. Yeah. So Israel wants to, the government of Israel wants to withdraw from the WHO, just as the executive order of the president on the first day of his arrival to the office, so we are following, right? But there was a discussion in the Knesset, two discussions that I represented the Israeli Medical Association, Harry, and I've never been to such, I can tell you for hours how I feel. I need a psychiatrist. It was awful. And so I never knew that WHO is encouraging masturbation, gender change, and other awful things, and that we are delivering vaccines with some things to control humanity. And things that you cannot imagine were said there by coalition members. The sad thing for me is that there was no other voice that came except for few of us from NGOs and from some groups in Israel. And The good thing is that the Ministry of Foreign Affairs, the Director General of the Ministry of Foreign Affairs was there, and he said that this is not a good idea. The Ministry of Health could not speak out because the minister could not allow that. So I can tell you that for now, we haven't yet pursued that, but and the good thing that I learned that Israel cannot withdraw from WHO. According to the Constitution, when the WHO started, the US granted itself, since it was the founding member, it granted itself the ability to withdraw. So they have the ability to withdraw. We cannot withdraw. What we can do is not pay the funds per capita that we are supposed. After 2 years, WHO will kick us out. And when they kick us out, to get back will be not easy. But the thing is that there are other alternate being created by the other side, which is more for different types of medicine, no vaccines, and other things. So these organizations are being created as we speak. They are organizing. They don't like me. Yes. That's it.
Okay, so Dorit, thank you again. I will now say a few hagigim following Dorit's presentation. So in my opening remarks, I said that we're actually seizing the activities of the center in its current structure as a campus-wide activity, and we still have a few examples in the conference today, so we'll hear about societal aspects from Sigal later, some about economics from Oran here. We'll hear additional from the public health aspects, but it's really difficult, as you said, because the interest, and there are also movements in global politics that are not supportive of investing efforts in vaccines and things that Dorit spoke about. Just a remark, so I congratulate you, Dorit, and you, Brura, for doing similar things here at Tel Aviv, but perhaps the schools of public health should be, you know what a pilot light in a gas stove is? The small kindling light in the bottom, so when you do the tick, 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 it turns on. So across campus activities are difficult to maintain. The question is, within a university, what is the correct home for efforts of preparedness? Now, just a comment, schools of public health are not easy to maintain in an academic setting. Why? Because most of the professionals, paramedics, nurses, physicians, they don't hold PhD degrees, and most of them don't do research. So you don't have a large pool of people to recruit from the next generations of the professionals that will be responsible for the academic aspects of such issues. So I leave you with these thoughts. I would just like to comment that actually I think we're closing a circle here. I think 4 years, no, I don't think, I know. 4 years ago, our plenary speaker was my sister-in-law, Professor Galia Rahav. I suppose you heard her name. I think you both went to medical school together, but at the time, I mean, they were trained as physicians, as experts in infectious diseases, but we saw the shifting of the tides over time, and we have to persist. That's what we do as scientists. So we'll now start the coffee break 10 minutes early. We'll reconvene here at precisely 20 minutes past 10 for the first session. Thank you.